This in-service video will provide product setup and use of the Arrow Thermodilution Catheter. The Arrow Balloon Thermodilution Catheter is indicated for use in measuring cardiac output by the thermodilution method. The thermodilution catheter can be used to measure right atrial pressure, right ventricular pressure, pulmonary artery pressure, and pulmonary capillary wedge pressure. In addition, the 5-lumen thermodilution catheter can be used for the continuous infusion of solutions. Arrow thermodilution catheters are available in 5 French, 80 cm length, as well as 6 French, 7 French, and 7.5 French, which are each 110 centimeters in length. Catheter body styles range from firm for manipulation and control, to a mid-range for flexible torque control, to a softer catheter for optimal flotation. The flow-directed balloon thermodilution catheter is made of radiopaque polymeric tubing. The catheter has 4 or 5 parallel lumens that form separate extensions at its proximal end. The balloon inflation lumen has a one-way stopcock at its proximal end and a latex balloon located near the catheter tip. The catheter is tapered under the balloon, so the external diameter of the catheter remains uniform along its length. A controlled stroke syringe is provided for occlusion pressure monitoring. A thermistor bead lies proximal to the balloon. During diagnostic procedures, the thermistor is connected to the cardiac output cable. The thermistor bead measures the temperature change of a known amount of solution, determining the cardiac output as it is injected through the CVP port and flows into the pulmonary artery. Precaution: insert the catheter using continuous ECG and pressure monitoring, and confirm placement with X-ray. Use of fluoroscopic guidance for insertion is recommended whenever possible. All catheters are marked in industry standard 10 cm increments. Advance the catheter into the right atrium. Inflate the balloon to facilitate passage through the structures of the heart. Advance the catheter through the tricuspid valve and into the right ventricle. Then continue through the pulmonary valve into the pulmonary artery, until the pulmonary artery occlusion pressure is observed. At that point, deflate the balloon. For continuous PA monitoring, the distal end of the catheter should be placed centrally in the pulmonary artery, as evidenced by the PA waveform. Precaution: catheter must be distal to the pulmonary valve to inhibit slipping back into the ventricle, but not so distal that the inflation of the balloon could damage the artery. Warning: care should be exercised when passing the catheter in patients with left bundle branch block. Right bundle branch block induced by traumatic catheter passage could result in complete heart block and asystole. Precaution: antiarrhythmic drugs and resuscitation equipment should be available for emergency use. For complete instructions and precautions, please refer to packaged instructions for use.